You are listening to Radio Ramadan 365 podcasts.
Assalamu alaikum and welcome back to Radio Ramadan 87.7 FM. You're listening to a wonderful new show called Sparkling Insights. Myself, Maimuna Chowdhury, with Shabina Gamran, inshallah, as your hosts. And so you've just listened to the bit about inspirational person, and I hope that you have benefited from that and took inspiration as well, inshallah. So as you know, that our program every day is basically based on 3 different bits. So inspirational person, and then we go on to our discussion. So that's where we're going to move on to, inshallah. So today we're focusing on an important topic, pharmacy services and the facilities available to support your health and well-being, whether it's getting the right advice on medications, understanding essential pharmacy services, or learning how to stay well during Ramadan. This discussion will be packed with useful insights, but this also goes beyond Ramadan. It's not just about Ramadan, inshallah. So, we have our guest in the studio with us who should be able to shed light on the changes, the immense changes that have happened within what you can go to your GPs for and what you can come to your pharmacist for, inshallah. So with that said, we're delighted to welcome our special guest, Sabah Mahmood. Assalamu alaikum, Sabah.
Walaikum salam.
Who is a clinical pharmacist with 14 years of experience working in pharmacies, hospitals and GP practices. She has specialised in blood pressure treatment as well as medication in the elderly. Today, she'll be sharing her expertise on how pharmacies are evolving to serve the community better, inshallah. Assalamu alaikum, Sabah.
Again, thank you for having me here.
You're absolutely welcome.
No, it's a pleasure to have you, Sabah, today, alhamdulillah, because we realise that there are many people in our community, and when we look around and see the facts that there are so many people who don't understand what facilities are being given at the moment. I mean, I personally work myself out within the community, and you realise when you're working with them or when you're going to see them that they really don't know what's out there, especially since obviously I think the NHS and the GP services have come down and they've passed on their you can say their
It's a lot of more common things that they've passed on that the pharmacies can deal with this.
Yes,
and I think it's just people have found, especially since COVID, trying to get appointments with their GPs and long appointment times and waiting times, whereas a lot of those conditions classically could have been treated by pharmacists. The service just wasn't there.
Yeah, they never gave
now
them
it's
to them.
there,
Mm-hmm.
but yes, I think a lot of people still don't realise there's a lot of things they don't have to wait for the GP for. They can just access the pharmacy, which is a lot easier.
A lot easier, and you don't need to wait for appointments and etc.
And I think this is wonderful news, isn't it, for people who genuinely are waiting to be seen, and it's news that we can be seen by somebody a lot faster.
A lot faster. Yeah. Before I go to the first question, what is that service called?
So it used to be called Minor Ailment Scheme, which people might know it as. And it's still minor conditions that are treated, but it's called Pharmacy First.
Mm-hmm.
And it's available in every single pharmacy. There are some pharmacies that will offer a bit more of an enhanced service. It's called Pharmacy First Plus.
Mm-hmm.
And they are the pharmacies that also have a prescriber on the premises, and they can treat a much wider variety of conditions. And again, if you go to your local pharmacy, if they don't have a prescriber, they can signpost you to somewhere more convenient. But yeah, I mean, even if you forget the name, if you go into the pharmacy and let them know what it is that's happened, they'll be able to advise you on it and give you treatment.
Okay, that's great to know. So apart from getting their prescriptions dispensed, what else can people go to the pharmacy for?
So obviously you've got a lot of different types of services. You're going into pharmacies sometimes just to buy medication over the counter, whether that's painkillers, hay fever medication, any sort of stomach problems. There's lots of different things you can buy or get a prescription for. You would also go to your pharmacy just to get advice from your pharmacist about your medicine, if you're wanting to know if it's safe for you to take, what other medication is safe to take along with it, side effects. And also, if you're struggling to actually take your medication, the pharmacist can give you advice on different formulations that might make it easier for you, or different ways they can dispense it to make it easier for you. we also, like I mentioned, there's some pharmacies that have a prescriber on board, so they can offer a variety of services because they can prescribe more or less anything. There's smoking cessation, so to help you try and quit smoking and for it to be done in a much easier way for you. And again, it's a free service. A lot of pharmacies now also offer Hajj and Umrah vaccines, which again for our community is so important. I think recently they reintroduced the requirement for the Umrah vaccine again. So again, you can get that in a lot of different pharmacies. They also offer a delivery service, so for patients who can't really get out the house, or they do live with family, but family aren't available during the day they're working, whatever, the pharmacy can come out and deliver your medication to you. And I previously also mentioned about making dispensing a bit easier. So if you're someone who's struggling to take medication, they can make up weekly packets for you, and it just makes it a lot easier, especially in elderly patients, to take. And also there's a variety of common clinical conditions that can be treated in the pharmacy as well now.
Pharmacy as well.
Sounds like, mashallah, the pharmacies have really evolved, haven't they?
Yeah.
And I'm surprised to hear about the Hajj and Umrah vaccines. I think I would have thought you have to go to some private clinic and make an appointment. Yeah. So that's actually quite good to know for our community as well, that you can actually go to a pharmacy that does this, have the service.
I mean, and like I said, it won't be every single pharmacy that offer it, but more often than not, they'll be able to signpost you on your nearest pharmacy that can offer it.
That's brilliant.
That's really good to know. But when you talk about obviously the vaccines, and you say that some pharmacies do them, so is it particular? Can you engage? How do you contact these people, and how do you get in touch with them? So,
like I said, if you just pop into your local pharmacy and ask them, they should be able to find out for you where your nearest pharmacy is. Otherwise, to be fair, even looking online, it really just depends on whichever pharmacy you go to, if that pharmacist has been trained to do the vaccines and signed up for the service. So not every pharmacy will automatically offer it, but more or less in every area, whether it's Glasgow South, whether it's North, the East sector, there is at least 2 to 3 pharmacies that will offer it. So usually what I would say is either put it into Google, otherwise if you just ask your local pharmacy, they'll be able to find out where nearby can offer it for you.
Okay, yeah, that's brilliant. And what about, like, when you say clinical issues, what kind of clinical issues do you cover?
So there's a wide variety now compared to what we used to be able to do. So for example, most common, like hay fever, for example, you can go into your pharmacy and they can supply you with eye drops, nasal sprays, your tablets, and then now with enhanced service they can also give you some of the stronger antihistamines that used to be prescription only from the GP. But you can now get it from, so it's called fexofenadine. It's one that is effective for a lot of people, but it used to only be available by the GP, but your pharmacist can give it to you now. There's also things like if people are suffering from oral thrush, so that can be quite a common condition for people using inhalers, people who are on, say, chemotherapy or immunosuppressant drugs, for a variety of things that you might get oral thrush for. Again, it used to be you could buy a gel from the pharmacy, but now they can give you the actual treatment the GP used to be able to prescribe. You can go into your pharmacy and they can prescribe it to you. Other things, you can do conjunctivitis, so if you've got a kind of eye infection, whether it's bacterial or whether it's allergic, there's different types of antibiotics. So you're best just going in and speaking to the pharmacist. They can tell by looking at the symptoms which type of eye drop is best for you. And again, there's no need to contact your GP for something like that. There's a variety of conditions where now your pharmacy can give you antibiotics for now. So if somebody comes in with impetigo, which is a rash on the face, it's kind of crusty lesions around the mouth, they can provide you with an antibiotic cream for that now, and it's a simple 5-day treatment. One of the most common ones we see, especially with women coming in, is urine infections. So UTIs can be treated by your pharmacist as well.
Okay, that's really good.
There are a lot of these conditions that are certain kind of cut-offs and requirements where the pharmacist might not be able to, but what I would always advise is still go in and see them, because you'll probably get to see them before you get to see your GP, and they can advise you that if it's something that they can't treat, at least you've already seen them and they can escalate it to the GP.
Yes.
I mean, before we go on and ask you even more further questions around clinical stuff, do you find yourself in a position where, as a pharmacist, there's a lot more responsibility on your shoulder, or was this a welcome move from the pharmacist, or was there?
I think a bit of both. It was definitely a welcome move, because I know when I first qualified, it would get quite frustrating when patients would come in and you know what treatment they should get, but you're having to be like, go speak to your GP.
Of course, by law, you couldn't.
You know, and then some, especially if it's someone, say like a really elderly person coming in, they've made all that effort to come into you, you know what they need, and you're having to be like, actually, just for that thing, you're going to have to go to your GP. So it's good in that sense that now we can just treat the patients and we're comfortable treating them. There has, in some cases, though, it can get quite overwhelming where it's very, very busy in the pharmacy, and obviously it's not an appointment basis. You can just walk in and ask for the treatment. So in that sense, pharmacies are a lot busier than what they used to be. But again, I think when you can see the benefits having to patients and to the community, then you don't mind providing that service in, because it has such a huge benefit with people, especially for, like I said, when we can give antibiotics, the quicker someone is treated, the better. So when you know that you're able to provide that antibiotic and get treatment in before they have to end up being hospitalised, it makes a big difference.
Yeah, it makes you feel better as well.
Yeah, you feel better with the fact you're providing a good service for your patients that are coming in.
Okay. So that's a good insight into the life of a pharmacist from the perspective of taking on more responsibility, and it's something that you welcome, because you personally feel like there's benefits for especially people who are elderly or people who need care straight away and they can't get to a GP. So it's been really insightful so far, and we have lots more time with you, inshallah. So Sabah, you touched on UTIs amongst other services, but I wondered if you wanted to go into a bit more detail around that.
Yeah, so they've actually relaxed the requirements quite a lot for who can be treated for UTI. So it's now any woman over the age of 16. Unfortunately, we can't treat men in the community pharmacy, and the reason for that is UTIs are more common in women because of our physiology. And if a man was to get a UTI, it tends to be a lot more severe, so it should really be seen by a medic. And the treatment's longer, so that's the only reason. But if you're a woman over 16 with UTI symptoms of say increased frequency of urine, any sort of burning sensation, lower back pain, things like that, you can come and discuss it with the pharmacist, and 9 times out of 10 they can probably treat you, and it's a simple 3-day course of an antibiotic. There will be some times where they can't treat you, and again, the only reason they wouldn't treat you is for your own safety. So if you're someone who keeps getting recurrent urine infections, ideally they'd rather you go to your GP, because we need to figure out what's causing these recurrent infections. If you just kept getting them treated by the pharmacy and the underlying conditions not being seen to, it's not going to help. And things that can be is, if you're getting recurrent infections, is there maybe a resistant bacteria you've got, or is it signs of maybe early diabetes that needs to get checked out? So it's usually it's for patient safety. We would never say no for any other reason. But like I said, women over the age of 16, if you're getting any symptoms, don't wait for the GP. Even if you're not sure if you can be treated, pop in. And if the pharmacist can't, they'll give you safeguarding advice for what steps to take next if they feel it's not appropriate.
Okay, so when you're talking about obviously the pharmacy issues and how people can be treated, what types of conditions can be treated in the pharmacy?
So there's other things, the kind of newer things we can now do, like everything I've mentioned up until now, like hay fever and stuff, we can always treat. Some of the newer stuff now, we can also treat shingles, which pharmacists didn't used to be able to. And again, I know personally for me, it used to get quite frustrating. I'd have someone come in, I'd be like, I know you've got shingles, but I can't do anything. So we can provide shingles treatment as long as you're over the age of 18. We can give antibiotics for bacterial skin infections, so things like if you've had an insect bite that's become infected. Some people might have cellulitis, so basically symptoms of if on your skin you've come up with some sort of rash where it might be a bit of a lump, it could be quite red and quite hot to touch. That's something that we can treat in the pharmacy. In fact, even today before coming here, I had 2 patients, and I had someone with an infected toe and someone with an infected finger. Now imagine, again, being like a Friday night or Saturday morning, you've come in and we can't treat you. You're then trying to get through to NHS 24, or you're trying to get through to your GP, and it's just delaying your treatment. So that's probably a big one that we didn't used to be able to do, and we can now. Obviously, I mentioned UTIs earlier, and I mentioned the impetigo. We can also do things like contraception medication can be given as well.
Okay, so that's really interesting. I'm sorry I'm cutting in just now, but it is very, very interesting, and I think the contraception is going to be, there's a lot to discuss there. So it's been very, very helpful so far for the community. I'm sure people listening in, if you're driving or if you're just sitting at home listening, this is very, very interesting information for you all to, maybe go to the pharmacy, go and see a pharmacist for something that they can treat you for, rather than having that frustration of not being seen by the GP, which I'm sure most people are frustrated just now. So stay with us. We're going to dive into this valuable conversation further. But before we continue, let's take a short break. We have an ad break coming up, inshallah. And so see you.
Assalamu alaikum, welcome back. Welcome back to Sparkling Insights on Radio Ramadan 87.7 FM. You're listening to Shabina Kamran, Maimoona Chowdhury, and our guest, Saba Mahmood. If you've just joined us, we're discussing pharmacy services and facilities available to support your health. But just before we go ahead, there's a little quote that we would like to share with you, which is, your health is an investment, not an expense. Take care of yourself, for a healthy body leads to a healthy mind and soul. What do you say for that, Maimoona?
I think that's a brilliant quote. I think that's something we all need to listen to and practice.
Yeah, exactly.
Very, very good quote. I think, especially when you're saying it's an investment, a lot of kind of conditions and stuff you see people coming in with. See, if you invest in yourself and actually looking after with your diet and your exercise, you don't have to be on like 10, 15 different tablets all the time. It makes a huge difference.
Just about what you're eating, what you're doing for yourself, how mobile you are.
Yes.
That makes a big difference. But once again, we have with us Saba Mahmood. Thank you, Saba, for coming in, who is shedding light on the vital role of pharmacies play in ensuring accessible healthcare for all. So, Saba, when we were talking, we were just leaving the contraception topic you were about to start, so you can continue with that.
So, basically with the contraception, now it is only oral contraception, and it's only a particular tablet the pharmacy can give you. But as for, say, while you're waiting to get some form of long-term contraception, whether you're waiting to get a clinic appointment, which is quite long waiting times at the moment, the pharmacist can bridge that gap in between and provide you with an oral contraception up until you can get your appointment for whichever other method you wanted. So it's just quite good for those people who are in limbo trying to wait to get to clinic. So if you're between the ages of 13 to 55, they can provide you with a daily tablet to take. They'll obviously go over the risk factors with you, check your blood pressure, make sure it's appropriate. And it means for those few months that you can't maybe get to the clinic, you've got something up until you can get a proper appointment.
Okay. That's another thing that I wasn't aware of, so, and I'm sure many listeners maybe weren't aware of, so that's really, really good.
Yeah, I think it makes a big difference for especially people who are coming new into the country and they don't realise what facilities are available for them, because it makes it very difficult when they're working for social workers or with people that they're new to as well, and it's very impossible to try and understand every single aspect of what's going on in this country or how they need to adapt to it. So I think even like trying to understand how the GPs work here or how the hospitals or how the A&E work, I think this is a very big factor as well, where you come into clinical pharmacies as well, where that well, we know because we were born here, we've lived here, that these things, how they've developed in time, but they don't. So instead of working in the fact that okay, they need to go to the GP if they're going to get an appointment or not, shall we try the pharmacy or not, will they be able to do anything for us or not? So for someone to be there and to give them that help is a big insight to this. The other question I would like to ask is just popped up into my head, that see if there was somebody that was coming to you, didn't have any spoken language of English, and they couldn't make you understand how or what they wanted and what their problems were. Do you have any kind of a facility there where you can listen, kind of that interpreter issue thing going on, where you can have somebody interpret for them, or so that you can understand what they're saying to you?
Yeah, so I don't think they have specific interpreting services at the moment in pharmacies. I know, for example, if I had a patient come in and I couldn't understand what they were saying, usually it'd be a case of, right, is there family or a neighbour or friend that they can bring in with them, and we can discuss it with them. If that was something we really couldn't do, what we would probably then be doing is contacting their GP practice to say, look, we've got this patient in, they've got a few issues to discuss, they can then arrange an interpreter. Every GP practice also has a pharmacist inside. So if it's purely a pharmaceutical issue and they're not able to bring a friend or someone into the pharmacy with them, your GP practice can then arrange for an interpreter, and they can make that appointment with the pharmacist in the practice instead. Okay. Because that is like an actual formal NHS service that they have. Like I say, that's probably what me and most pharmacists would do, is first try and figure out, is there somebody else here available who can interpret for us? And if not, we pass it to the GP practice to arrange that appointment with the pharmacist there.
Yeah, obviously, because you've got a lot of languages that you need to deal with. It's not just the one, so you can't exactly ask one person to be there for one particular language. Yeah. You would need a kind of a service where you can pick up the phone and they say, okay, I need somebody here to help me with this. Do you think this kind of service would benefit you in a way if it was provided to you, to make your life a little bit more easier?
Probably, I think, depending on maybe what area you're working in and how busy the pharmacy is, especially because, like I said, with your pharmacy, it's a walk-in service, so you don't know who's going to come in, you don't know what problems people are going to come in, so you're not really prepared. I suppose, if you've got an appointment with the GP, they're prepared in advance, they know this person's coming, I have to arrange an interpreter. We don't have that luxury in the pharmacy. Certainly, if there was a service that available where we can just pick up the phone and say, right, can you interpret this for me? It would be ideal. How practical that would be, I don't know. I don't know.
Well, we do have phones now where we can just...
I suppose, and there's Google Translate now as well.
Yeah,
So there is that. And I think it really depends what the patient's coming in with. If it is a kind of whole range of things, like so they could be new to the country and there's a lot to discuss, then that probably would be better off at the practice and give like a good, half-hour appointment and go over everything with them. If it's just a one-off thing, I suppose you can try and figure it out. Will Google Translate work this time for this short condition? It's just you also want to make sure that they're understanding you as well. If you're giving advice, you want to make sure they fully understand what you're asking them to do. So in that case, I think I'd probably be more comfortable with someone who knows the language to actually speak to them.
Yeah, just in case you don't want to pick up something...
Yeah. And just interpret it the wrong way to them, especially when it is, like, for example, if I'm going to give them like an antibiotic, you want to be 100% sure they know what they're doing with it.
Yes.
So in that sense, I think I'd be more comfortable if I had somebody there. So yeah, ideally, if there was a pick up the phone service, it would be great, but there's nothing like that at the moment.
Okay. That was very interesting.
Yeah, alhamdulillah. And touching on the point of, obviously, you mentioned before that working with elderly patients, can you go through with what you've been doing with them? I think you talked about a service that you do.
Yeah, so that actually is part of my other job that I do in the hospital. But what you find in general with elderly patients, say they're reaching like 70, 80 years old, they've probably been on medication that they've been on for 10 plus years, whether it's for their blood pressure, whether it's for their diabetes. And a lot of these medications, as people get older, we relax a lot of their targets. So the blood pressure that we would expect for an 80-year-old is not the same blood pressure we would want in a 60-year-old, for example. And the reason for that is if you're going to control the blood pressure so tightly and in such an elderly patient, they can be at risk of falls, which can lead to a whole other set of complications. Likewise, as patients get older, certain bodily functions like their kidneys, for example, aren't as efficient as a younger person's are. So it means they're not always clearing the medication as efficiently out their system. So again, there's certain medication we would want to be looking at and start to reduce doses in them. Same with diabetes, their targets are a lot more relaxed when you're older, so they might not need as much medicine at that point. And a lot of the time, if you're doing a medication review in an elderly patient, your aim a lot of the time is to see what can I now stop in this person. It's very, very common for elderly people who end up in hospital can be either due to falls because of their medication or side effects from the medication, and it's because that medicine's now not appropriate anymore. So I would always urge people, if you have a family member, an elderly family member, and they're on, 6+ medications, or just they've had a recent deterioration, contact your pharmacist, whether it's just popping into the community pharmacy. They won't be able to do a full review for you, but they can signpost you. And then if you speak to your GP practice, like I said, they have a pharmacist in practice who will go over the medication review with them. Because you'll find a lot of the time, a lot of those medicines aren't appropriate for them anymore. And I see it a lot working in A&E where we've had elderly people come in and it's purely down to unnecessary medication that they've had these falls now. Also, it's really important as patients get older, you know, they might have conditions like dementia, for example, and that's causing them to forget to take medicines, or it's causing them to have swallowing difficulties with their medicines. So again, you have to look at, can we change the formulation, or can we make this easier for them to take? And there's so many other facilities that can be provided to these patients to make it easier for them. And I think it's so important. Again, like I said, any worries you have at all about an elderly family member, either speak to the community pharmacist or, like I said, pick up the phone to your GP practice and they can go through the full review with you.
Okay. That's
basically,
very interesting. Sorry, that's very interesting that I hadn't sort of thought of that concept that younger people, and there's a difference in medication, and they might be a bit more relaxed when they're older, and the reasoning behind it. So if you are listening to this and if you have somebody who's elder or you're elderly yourself, it might be an idea to do a review before you even a fall. Just come and get a review done, just in case if you haven't had that.
And the benefit is that you can get that done from your local pharmacist. So that's the best thing about it. That before you couldn't. I mean, I don't know if the option was available. You'd have to go to GP. And again, that's another waiting time. But for yourself to say that you can easily walk into the pharmacy, whether it be your son, your daughter, your granddaughter, your grandson, anybody could walk in for you, including yourself, and get these things checked so that you don't have such, issues.
I mean, like I say, with the local pharmacists, they won't be able to do a full, thorough review, but they can look at the medicines and signpost you and be like, actually, yeah, maybe this does need looked at. It means you then can go to your GP practice, but like I also mentioned, every GP practice now has a pharmacist within the practice, and they are there to carry out these medication reviews. You'll get an appointment much quicker with them than you would with your GP, and they've actually got the time to spend longer with you. They also have teams called medication compliance teams. So the pharmacist works with them within the GP practice, and they also link in with your local pharmacy, and they will all work together to come up with plans to whether it's reducing medication, and then what can we do to make things easier at home for you to be able to take your medication, whether that's putting it into weekly packets for you to take, whether it's trying to arrange for carers to come in and do like a little med prompt. So there's a full team in the community that will link in with your GP practice, with your pharmacist, with your pharmacy, so that you as that one individual family member doesn't have to be so overwhelmed and contact every single individual service yourself.
That makes it so much more easier.
So and most localities do have the medication compliance service. So again, it's something as simple as phoning your GP practice, and you don't need to make an appointment with the GP. You can just say, look, I'm struggling with them taking their medicine, this is what's happening. They will then arrange an appointment with the GP pharmacist or with the compliance team, and they will take over everything for you and review everything that they can.
That's so good to know. There was an incident, I could say, or something that happened just recently. I was with an elderly patient, and she was literally on her own. And when we asked her upon, where's your medication, what do you take, and how are you taking it, and when are you taking it, and she was a wee bit bewildered, to be honest. She was over 90 plus. She was living on her own, and she didn't have any kind of such help, and relatives and children were not with her either. So that was kind of like obviously quite upsetting looking at that. But the worst thing was that when we asked her about her medication, she didn't know whether she had took it or she hadn't. Did she take it in the morning? Did she take it at night? And she had one of those packs as well, but they were also full, so she wasn't sure whether she had took it or not. So what kind of how are those people looked after, even though they have the social workers behind them, or the occupational therapists and etc. coming in and looking after them, but how does this get looked at? So
with someone as vulnerable as that, who obviously they don't have family and friends around them, yes, it's a good thing they've already got the medication in that weekly pack, but that pack is only useful if you also have the capacity to know to take your medicine. So if you've got someone who's forgetful like that and doesn't realise, the pack on its own isn't going to help. So in that situation, what I would do is, again, contact the GP pharmacist to first review the medicine to see, is it all of it still necessary? Can we maybe try and reduce some? Once that's reduced, social work can get involved. Otherwise, the medication compliance team to possibly arrange carers who could come in however many times a day they have medicine. Now, they can't help them take the medicine, but they can do what they call a med prompt. So it's to come in and say, right, have you taken your morning tablets? And it just gives the patient a reminder. Another extra precaution for a patient like that who possibly, if they're so forgetful, the last thing you want is they go and take all their tablets in one go because they don't realise. So social work could help in this case. Otherwise, if they had family, they can actually purchase what we call a lockbox. They're actually available online on Amazon. And when the medication is delivered by the pharmacy on a weekly basis, carers can lock that medication away, and so the patient actually can't access it at all. And it be for when the carers come in 1, 2, 3, 4 times a day, they will open it, they'll prompt the patient, and then lock it away again. And I think that's kind of all the safeguards put in for them, just to make sure it's safe for them to take, and they're on the appropriate ones, and someone's reminding them to take them as well.
Okay, so that's very useful information.
That's very useful,
inshallah. Okay, so let's move on with another question. So what additional, you spoke about pharmacists, and then you spoke about prescribing pharmacists.
Yeah.
So there seems to be like a difference there. So like what additional services can be offered by prescribing pharmacists?
So with a prescribing pharmacist, that basically a bit of background, it means they've gone through an additional uni course to become prescribers, so they can literally write out a prescription the same as what your GP can. So there are enhanced services that can be offered by them. One of the big ones, which I found to be really useful, is they can treat chest infections. So again, if you've gone into a pharmacy with a prescriber, they can sound your chest for you the same way your GP normally
that's
would.
amazing.
And check if an antibiotic is suitable, and they can give you the antibiotic for the chest infection. And again, if your local pharmacy doesn't have a prescriber on board, they can signpost you to whoever does. They can treat probably a wider variety of skin conditions, and not just like the kind of sort of cellulitis that I touched upon earlier. They can also have a look inside your ear and treat ear infections. So before, pharmacies could only ever treat earwax. It wouldn't be like if there was an actual infection or pain in the ear, but a prescribing pharmacist can take a look in and give antibiotics as needed. And I think one of the main ones for our community, what they can also do is they can provide the tablets for women to delay periods. So if you're, say, about to go for Hajj or Umrah, or even sometimes I know people during Ramadan like to do it, but they want to delay their period, a prescribing pharmacist can give you the tablets for that time. And a lot of GP practices actually now don't do that service at all anymore because they know the pharmacy can. So again, for that one, it's quite good though, because you can either go into the pharmacy. Otherwise, some of the kind of bigger pharmacies, like say Boots and Superdrug, they actually do it all online. For that service, you can go online, put in your details, and they'll just get the prescription ready, and you just go in and pick it up. Obviously, for the other ones, like chest infection stuff, you'd have to physically be there so that they can examine you. But yeah, it's a lot more things now that, again, you would have usually had to go to the GP for these things.
No, that makes
but you can just walk in and...
It makes sense, and it's actually very, informative for the community to know these things and to, listen in today. And I hope it has made sense to a lot of people. And we sitting here have realised the fact that, there's some things that we didn't know about either.
I've learnt lots.
And, and that you can actually just walk in. It just makes it a lot more simpler and easier. So Jazakallah khair for coming in.
No, Jazakallah for having me.
We've come to the end of our discussion, so a heartfelt thank you to you, Sabah Mahmood. Again, if you've been listening, Sabah Mahmood was our guest, pharmacist who's come in and given us her valuable time and sharing her expertise. And we hope that today's conversation has given all the listeners, like us as well, valuable knowledge to support your well-being, inshallah. And I think that's the end of this sort of discussion. So Jazakallah khair to you, Sabah, for coming through.
No,
Jazakallah
Jazakallah
Thank you so much for coming through. That's from the both of us, Shabina Kamran and Mahmoona Chowdhury. We say Allah Hafiz. May Allah bless you with health, peace and happiness. And before we sign off, we'll leave you with the final thought. When your body is healthy, your mind is clear and your soul is at peace, you are truly rich. Until next time, stay safe, stay blessed and keep shining. Allah Hafiz.